Nursing Care Plan Assessment. Hi, everyone. In this lesson, we're going to talk about subjective versus objective data. Let's dive right in. First step is subjective data. This is all about what the patient shares with you, their story, feelings, and concerns. It's their experience with health, symptoms, and pain. As a nurse, you're listening and taking their word for it, but you're not seeing it firsthand. For example, a patient might say they have lower back pain, need to use the bathroom a lot, or feel depressed or anxious. These insights are super important because they help you understand what the patient is going through. So keep those lines of communication open. Let's dive into objective data. This is all about what you can actually see, hear, smell, or measure as a nurse. For example, if you hear decreased breath sounds in the lower lung fields, you jot that down. Spotting edema in the lower legs, document it. If the patient is using the incentive spirometer well or has a blood pressure of 130/90, those are important notes too. Basically, it's all about capturing what's happening right in front of you. So the key difference between subjective and objective data is that subjective data is information that the patient tells you and it asks their story. It's how they feel, how they experience their illness. Whereas objective data is information that you can see and measure as a nurse does. And measure as the nurse. Understanding the difference between subjective and objective data is super important for us as nurses. When we're making nursing diagnoses and care plans, we need both sides of the story. If we only focus on objective data, we might miss crucial info from the patient's experience. It's all about blending what we observe with what the patient shares, so we can provide the best care possible. Alright, so I hope that this was helpful. If you have any questions, go ahead and leave them in the comments. And if you enjoyed this video, don't forget to like and subscribe.